in a series of effective practice sharing events. People sharing effective practice from the first year, I suppose, year and a bit now, of the working together to improve school attendance. And today we are focusing specifically on the northwest of England. And I have the pleasure to be joined this afternoon by Katie, representing Rochdale, Morag on behalf of Cheshire West and Chester, and Penny from Knowsley. For those of you who don't know me, my name's Adam Luke, and I lead the School Attendance Policy and Strategy team at DFE. It's an absolute pleasure to have you all with us this afternoon, and to the many people who are watching this as a recording. I know our ministers are enormously grateful of all the wonderful work that's going on across the region as a whole, from Bury's work to allocate a lead attendance officer to all schools, Salford's new locality-based model with attendance at its core. Just two examples there from Greater Manchester, St Helens work, on medical-related absence down on Merseyside, and everything in between, including, I know, some really great work in Blackpool on training for attendance social workers. And I know everybody is at really different points of that journey and on the way to fully implementing the expectations in the guidance. And that really is the point of this afternoon, to celebrate a little bit of where we've got to, and to hear about some of the people who are further on in that journey. And we'll share three very different approaches this afternoon to delivering the guidance. The guidance is very specifically a set of core responsibilities that you tailor to where that works for you in your context, and you'll see the variety of ways in which today's speakers have done that since September 22. And I hope somebody finds everything to, or something at least, to take from that. And secondly, really, it's your time. So if you're earlier on in that journey, or if you are making progress in that journey but see something that interests you this afternoon, it's your time and your opportunity to ask questions of your colleagues from Rochdale, from Cheshire West, or from Knowsley, and to find out about how they went about what they did. On housekeeping, as I say, we're a small group, but the session is being recorded so that people can dip in and dip out later as well. So I'd appreciate if you could raise your hands if you want to ask a question. I'll make sure that there is 10 minutes at least after each speaker for you to do so. You can also pop questions in the chat as we go. If you think of things and want to remind us of them at that point, and then I will gather them up and put them to the speakers later. And finally, before we get to the speakers, and I know that's what you're here for, so I will be quiet in a moment. When I was in Rochdale last week, we had a really great conversation about the importance of celebrating all the small successes along the way to the implementation. And as I say, everyone is at really different stages of that implementation, and I don't for a second underestimate the scale and complexity of that challenge, not least against continued very high absence rates, and the cost of living pressures and so many other things. But we should remember the individual success stories and the individual children's lives that have improved immeasurably since the guidance came into force, and the improvements that we're starting to see in the relationships and things that you rely on day to day. And to that effect, we're going to pop a link in the chat. So as we go along, please do just take a minute out of the session to share one case that you're really proud of this year. It might be your best, it doesn't have to be your best, it could be your most improved, or just one that has really stuck out to you about the new ways of working, where that's really helped in an individual case. And we'll try and read a few of those out at the end as well. Perfect. Over to Katie to make a start from Rochdale then. Welcome, Katie.
Thank you very much. Hi everyone, my name's Katie DeGeorge. I'm the Attendance and Safeguarding Team Leader for Rochdale Borough Council. So just a little bit of context really. I can see that I've got some of our GM neighbours on the call. I can spot my colleague Anne from Oldham, who's one of my little thumbnails. So it's nice to see you all. So we are one of 10 authorities across GM. And in terms of our percentage of children who are eligible for pupil premium, it is higher than national. Rochdale Borough is made up of 5 neighbourhoods. So we've got Middleton, Haywood, Rochdale South, Rochdale North and Pennines. And that's been really crucial actually when we've come to look at how we can best serve attendance in the borough. That's definitely been a change in terms of how we have adapted the way we work to support attendance. I think one of the first things I would say is we've really appreciated the guidance in Rochdale. It came at a time where we were looking at our purpose and that vision that existed within the team. It was very split when I came into post, and that was just before the pandemic hit. So we had that time, and on that recovery, then we had a real chance to think about how can we do things differently. So within Rochdale, we have absolutely appreciated this guidance. It's given us some structure to be able to move that forward. And it has very clearly set out those key responsibilities and strengthen that vision really. Next slide, please. So again, just in terms of how we've approached it, linking into what I was saying about the transformation of the team, I think it's important to provide a little bit of context. It felt as though that we had an idea, which again, it very tied in and linked in with the guidance working together to improve school attendance. But one of the fundamental things that we secured straight away was that buy-in, really, in terms of our SLT, that leadership and management. We'd had a review of our education welfare service. And I suppose one of the big things that came out of the work that we did is about relationships and communications with the schools. We knew that capacity was always going to be an issue. We can always be doing more than we're currently doing. There's always too much to do. So we had to really think as a team, what are the key priorities that we need to do and what are we doing it for in essence? We know that time is precious. So we had a big review of everything we were doing to determine, can we do it better? Can we be slicker by doing that? How can we do that in a more timely way? So we did that across all elements of the work, and that has completely transformed how we work. And when we celebrate those successes, some of that is down to working more time efficient, more savvy, and we've embedded that with our schools. And I'll talk about some of the things that we've introduced that will help to support some of that. Within Rochdale, we have a local MAT. It's our biggest MAT across the borough, mixture of primary and secondary schools. We really strengthen that relationship with our local MAT. We know that we've got a core offer that we have to deliver for all of our schools, but actually in doing that strengthening of that work with our local MAT and really understanding the context of the school, we were able to devise a traded offer with our MAT so that they have bought back enhanced services across the board. So I think that's really crucial. And going back to relationships, that's crucial in terms of we have regular milestone meetings with the trust attendance lead, and we work together in essence, and we make sure that we prioritise that relationship because it's really important and it ultimately impacts on attendance for our children. Communication has been crucial. We've ensured that clarity of communication to all of our schools. We developed comms for parents, carers. We've tried to best communicate what are we about, what's the education welfare service about, and especially around that support first approach. As colleagues will know, there was a burdens assessment that very helpfully helped us to identify that we needed to increase capacity. And again, this was supported by SLT and elected members. So we have increased our education welfare officers. We've been very careful about recruitment. We have devised an excellent induction programme. And some of the temporary staff that were in post at the time, we made them permanent. We wanted to ensure that our team had some stability and we had retention of excellent staff. And I think it's been really important to sweat the small stuff, if I'm being completely honest. We've had a relentless focus on making sure that staff CPD is there. We are consistent in our approach in terms of our expectations. We've had a really we thought about that from the start to the finish. We've provided regular mentoring for our new staff with a really skilled and experienced education welfare officer, and shadowed in different parts of the service so that we are, in essence, sharpening our saw really. We're keeping that skill set up where it needs to be. Staff skills audit, again, that programme of CPD and training. And with our team in particular in Rochdale, we make sure that we come together as a team because working in attendance, as you'll know, is pressured, it's difficult. Sometimes you don't get very many wins. You have to celebrate those ones that you do. And so it's important that as a team, we do come together and we're able to debrief at the end of the week. So every Friday we make time to have a programme of CPD, our team meeting, and just a feeling of coming together. We have positioned our education welfare officers in neighbourhoods, and that has been a big change for us, really, because at the time it was about who had a relationship with a particular school, and schools were reluctant to change their education welfare officer and vice versa, if I'm being completely honest. However, going back to that working more strategically, we needed to position our EWOs into neighbourhoods. And I have to say this year is the first year we've done it properly, and it's been hugely successful. We are already seeing the benefits of that in terms of that networking and that peer support. Next slide, please. Okay, so the use of attendance data to devise that overall approach, our strategy, I think that has been one of the biggest changes across the whole of the team. We use attendance data daily, weekly, termly. The View Education has been absolutely brilliant to be able to just quickly go and have a look at where a school sits in terms of severe absence, for example. Our starting point with some of that, which has allowed us to pivot our resources, was the end of year analysis that we did at the back of the last academic year. We analysed everything we'd done in terms of attendance panels, target days, casework, so that we could really have an understanding of what difference have we made. It's that so what question. And then drawing some of those conclusions from some of what we've done with regard to the level of support that we would provide for maintained schools, and whether schools traded and academies were buying a traded offer for us. Our data has allowed us to work differently. So, for example, within Rochdale, we established what we call our Fast Track Improving Attendance panel. Some of you will already have pre-legal panels or an equivalent, and that was no different in Rochdale. Within Rochdale, our pre-legal panel is called LEAP, our Legal Enforcement Attendance Panel. However, what we found is it was too late. So we wanted to introduce a panel at the beginning. It was our front door for casework, and that's our fast track panel. That has been massively successful. It's growing in strength. We've just been joined by mental health support team who now sits on that panel and supports us. It's multi-agency. And of the 221 cases that came through that panel last academic year, over 51% of those cases improved, but by a whopping 8.7%, which I think is absolutely brilliant when we think about some of the figures that come back for some of the other interventions and strategies that we adopt. So that's absolutely something that is now on the back of the data, will be here to stay forevermore within Rochdale. That regular analysis of data with our schools at targeted support meetings. Initially, we didn't weave them in. We would have our networking opportunities where we'd looked at data. However, what we found is it was too crucial not to. So at the beginning of every targeted support meeting, we spend the first chunk just having a look at what the data is telling us and seeing if that mirrors up and the impact of previous suggestions, previous strategies from the previous meeting. That has been really valuable and has allowed us to, again, to look at, do we need to change things, reposition that support and resource. We've been able to get the data into our Pioneers Trust, which is our secondary heads, and there's a dashboard underway for our primary heads, but also at the MAT CEO meetings. Attendance does feed into our MAT CEOs, because I think that's really crucial, that at those really high level strategic meetings that we're able to provide that snapshot of what attendance is looking like across the borough. And within Rochdale, we've had a real focus on severe absence. We've done a piece of work working with the ISOS partnership and colleagues from Nottingham University around really shining a light really on severe absence, and a really granular level, trying to determine who are these children, what do we know about them, who else has been involved. And we've done case studies, we've done audits, and on the back of some of that work, again, data-led, looking at a model of a team around the school for some pilot schools for this academic year and moving into next. We're well underway with our attendance strategy within the borough, and that's work that we would like to do with numerous colleagues, both health, children's social care, but external as well in our voluntary community sector, and really drawing together a pledge campaign for Rochdale. Next slide, please. So working with schools, I think one of the biggest things that we've learned is that we have to be consistent with expectations. So previously, you know, your phone would constantly be going with, can I just ask you a question? Can I just ask a question about this coding? And what we did is we had to look at mechanisms to be able to manage that that demand really of education welfare officer time. You know, we know that we've got EWOs linked to localities. They've all of our EWOs have a caseload of schools. They will have a caseload of children and families they're working with. So time is of the essence. So we had to be really, really on it, really organised with how are we organising our time. So the first thing we did is sort of said, well, let's eliminate any sort of potential questions that we can resolve by creating an attendance pack. And we set up within Rochdale, we have a Rochdale Schools intranet, what schools can access. So we put we put all of the information, there's absolutely everything you would need to know about attendance, children missing education, elective home education, and so on, into separate folders in a really easy to read, organised pack that sits on our Rochdale Schools intranet. And we were really clear with schools to go and check that before you come and approach us and ask any questions, because I would say 9 times out of 10, those questions could be answered within that pack. We really condensed it with policies on a page, and we did bite-sized information and made it really really easy to read. So that's the one thing that we spent our summer wisely, because we were able to prepare really for anything, any unforeseen questions. We worked with our local authority communications team, again, to show that commitment of attendance being everybody's responsibility. Within Rochdale, we collectively know that as Raising Rochdale. So again, it's just setting that expectations. We've done that with our early help colleagues, we've done that with our health colleagues. On the back of creating the attendance pack, we then launched that at a conference in September, and again that was really well attended. We were relentless in terms of making sure every school had a representative at that conference. We extended that to our independent school colleagues, and then on the back of that, every school had an initial meeting in the autumn term, very early on in the autumn term. And on the back of the attendance pack and the conference, we set our dates for the diary. So we went through with every single school and said, let's book our targeted support meetings in now. So we're not getting to the point where we're looking at, we've not booked it in and we've not got room in the diary. We had all of that booked in. We had all of our emotionally based non-attendance panels booked in for the year, all of our attendance leaders networks booked in for the year. Everything was in there. So schools know where they stood, where we stood, and there was an expectation that those meetings would take place. We created networking opportunities. So we had a attendance leaders network, which was predominantly aimed at our SLT, head teachers, attendance champions. That was virtual because, again, seeking feedback from schools, we know that it's often difficult to be able to get out of school consistently to attend meetings. So we made it easy and said, well, we'll hold the attendance leaders networks virtual. However, for our sub-attendance groups, which was for our operational attendance leads within our school, we wanted to be very clear that we felt they needed to be done in person. So we do those across the neighbourhoods. So we hold one in Rochdale, for example, we'll hold one in our Pennine district, we'll hold one in Middleton and Harewood. Our secondaries, because we've got 13 secondaries, our secondaries come together as a collective. And we just rotate where those meetings take place across the borough. They have been they've been wonderful really for our schools, and we know that from our feedback. We've had annual evaluations with our schools, and they absolutely welcome the opportunity to come together, and they see it as very crucial. And again, data feeds into some of those meetings. The data has allowed us to look at themed sub-attendance groups. So within Rochdale, and I'm sure colleagues will be no different, we've seen a huge increase around holidays in term time. So again, we've had just a real theme. In addition to the SAG, we've come together with a group of schools where they feel that would be useful for them. And we've really dug deep and peeled back the layers around holidays in term time. And on the back of that, some of the work that's come out of that is we've been on local radio stations. We have been into local mosques. We've done a number of different things really on the back of that. We've done one with our special schools because we knew we stood out. We were a bit out of kilter really with our other GM colleagues around our special school attendance. And we've got one in the pipeline around mental health. We've created a helpline. So every Friday, again, when the team are in the office in the afternoon, we have a helpline available to schools so that they know they can ring through, and one of the EWOs we have 2 EWOs on duty and we do it on a rota basis. They will be there to answer any questions. But again, we're really clear that I hope you've checked your pack first before you're ringing through. But we would welcome schools to ring in on Friday. Our educational psychology service, again, in terms of that working together, have opened a helpline every Wednesday for parents. And that is if parents are having any difficulties across across the board really, but absolutely around parents where they are struggling with the child's attendance at school. And the other thing that we've done is with our parent carer forum, we've held 2 listening events this year so far, where parents will attend and they will share their experiences of their children where they are struggling to attend school, linked with emotionally based non-attendance. And I would say that was really, really hard listening, but it was very, very much needed. And there's absolutely been work on the back of those parent listening events. They're very impactful and very powerful. So I think that I would sort of urge any local authority to consider that if you haven't already. Next slide, please. So the targeted support meetings, we put a lot of thought and work into the targeted support meetings. We co-designed them with our schools. We didn't want it to feel like a them and an us. It was, we know what the duties say in the guidance. We agree with them fully. It's the way that we want to work in Rochdale. So it's important that we do it together. So again, on the back end of summer, even over the summer, and that's the dedication of some of the staff that they contributed to this when it was actually they should have been on the holidays, and in the autumn term. We co-produced and redesigned a targeted support workbook and a tracker. And actually, a lot of schools have adopted these as their own business as usual. We work with our SIMS and our MIS suppliers to help with that preparation of populating the workbook. We feel it's really comprehensive and robust, and it does fit perfectly in terms of those key groups that we need to discuss within the guidance. We then, on the back of that, we identified champions across the borough who can lead on any queries around the workbook, so that we know if there's a change of staff, and we know that there are still key staff across the borough, really sort of strengthening that support, who schools can go to, as opposed, again, to coming back to your service or your education welfare officers. It does allow for quality assurance of a number of different things. And again, on the back of the targeted support meeting, we have created a sort of spin-off really in terms of a health targeted support meeting. So when we've had our meeting with schools, the following week, we'll be meeting with our linked school nurse and just sharing any themes. And on some of that work, it's very early days, but already we've had a rollout of immunisations because we identified there was an outbreak of chickenpox in one part of the borough. So I think it's really crucial that we are linking in with health in particular, but given illness is the biggest reason for absence. So that, I think, will just go from strength to strength, that relationship. And what we always do is after we've had any meeting, we'll make sure that we re-communicate that to the head teachers to keep them in the loop. Next slide, please. And again, so this is the last slide for me, so I'm conscious of time. Okay, so working with families where the LA is acting as lead professional or legal action is needed. The way that we've developed our graduated approach with schools is that we're expecting them to fulfil a number of to fulfil that support element before it's coming to us for a piece of casework, and that's worked. We can see the improvements actually this year compared to last. There's less cases being requested in really because schools are managing. They are managing in a supportive way, and that's been really good actually. I think we're seeing that in action. We've done lots of work on relationships with multi-agencies, with our colleagues, really trying to drill that and hammer that message around attendance as being everybody's responsibility. Within Rochdale, we have a separate enforcement team, so we work absolutely side by side with them, but they are separate to the education welfare officers, and they do lots of work around our aggravated offences and that 4441As. So they are there for the most entrenched cases. However, I would still say we will still be really sort of trying to support those families through that support first approach. We have that multi-agency representation at those key panels that I've mentioned earlier on. We've looked at different aspects of the service, our virtual school being one and our elective home education team being another, and our youth justice service. And we have EWOs embedded in those teams on a part-time basis. And again, the virtual school have, for children with a social worker, developed an audit tool and have been sharing best practice about what works best across our school settings. That's been a really good piece of work that's been undertaken with the virtual school. We've taken time to upskill the school staff and making sure that the work that happens is quality, especially in terms of attendance support plans, making sure that they understand the premise of a support plan, and that, again, we are on hand there if schools need any support with some of that, and making sure that, I suppose, really this guidance has really allowed us to really promote that vision of attendance being everybody's responsibility. And we are seeing that come to light in Rochdale. Next slide, please. I think it should be questions. Yeah, thank you.
Perfect. Thank you very much, Katie. So many great things for people to take in, and hopefully everybody, as I say, no matter where you are in implementation, saw bits there that they thought, oh well, I hadn't quite thought of it like that, or we could attempt to do that. I think for me, Katie, the bit that really stuck out was just taking a step back when the guidance came out and thinking, yes, we agree with where it's trying to get to. We feel quite away from there at the moment. What do we currently do that we can build on? What do we perhaps need to stop? Because lots of people, I think, on first reading thought, oh well, there are new things in here. How am I going to do that on top of my team that is already stretched? Where actually you took that step back and thought, we can't do everything and we can't do it as well as we want to. So where do we focus? Where do we begin? And how do we build to it? Any questions for Katie? Hands up. I haven't got any in the chat. While we waiting for hands or the chat, one for me, Katie, really was on this idea of the panel and bringing together a multi-agency panel, whatever we call it. It's something I know colleagues on the Wirral are doing where I was earlier in the year, and I find it really helpful as well. But you just want to say a little bit about how you came to that as an idea and how people might go about setting one up if they think it's useful for them.
Yeah, so yeah, our fast track panel, it has evolved really, because again, we knew that we needed to do that support first, I should say. And it evolved because the cases were so different. So now we've got the pleasure of being joined by a key worker from the mental health support team who will sit on there. And I think that's primarily become about because of the cases that have come to panel where there has been elements of mental health, anxiety, low mood, and for some of our other children who've been to that panel, we've had officers where we can see on our involvements, when we'd get the referral in, we can see, well, they might have EPs involved, or they've got somebody from the SEN team involved, or they have a social worker involved. So we felt it was really crucially important to get all of those key people together with parent, with child. And it's almost like a little strategy meeting, if I'm being honest, but it's not, from a parent's perspective, we're really clear to make sure that we do the prep work in advance so that they feel that, again, it's not done to them. We want to work together. So we really think that's crucially important. Obviously, they still have to have the element of parental responsibility around. There's a focus on making sure that child has access to the education to which they're entitled to, but we do it in a way that parents feel that they are being listened to, and it's very much about working together. And again, some of the learning from that is when we've done the deep dive on some of the case studies around severe absence. Yeah. And what we could see is families where they had, for example, one family had a supporting families key worker for the 4th time. And that was, we needed to really understand, well, why, what happened the first time, the second time? Yeah. And I truly believe it's because we weren't aligned in terms of that multi-agency approach around working together. We were all doing our little bit to support the family, working in silos. And we've seen the data, we've seen the stats from the fast track improving attendance, where attendance has improved significantly, and I genuinely believe that's because we are practicing what we preach and we're working together to improve attendance.
Thank you. And you mentioned, didn't you, about parent comes to parents and comes to the community, but also about involving parent voice. And again, I think that's something that lots of people think about, oh, we really want to do that, but sometimes wonder, where do you begin? You've got a very transient population. You've got a complex demographic in a mixture of different overlapping and moving communities, and you've got a big urban town and lots of rural parts as well. So do you just want to say a little bit about how you started?
Yeah, I would say one of the first things we did is we engaged the services of our communications team to support us with some of that. The other thing that we did is we wanted to communicate what our team was about in a number of different ways. So we have devised a little brochure that we are putting on our local offer, and that we want schools to put on their websites around what we're about, in essence, what the education welfare officers are about. I think one of the things that became apparent when we went to that parent carer forum, and it was that listening event, was that narrative of our service, and whether this is things that have happened in the past or just that general feeling of education welfare or attendance officers, they see that as they sort of correlate that with fines, with going to court. It's negative in the main. So we wanted to really shift that and say, actually, we want to help, we want to support you. So we're working hard on flipping that narrative of how our team is viewed. And we're doing that through some of the comms and capturing that pupil voice and that parent voice, but absolutely working with our communications team to help us do that in the best way possible. The other thing that we want to do with our schools is to align our working together across schools, partnerships, so our secondary head teachers, our primary head teachers, our health colleagues, and we're doing that really. We're having pop-up banners made for every school to really just communicate that message of we are working together to support attendance with those key agencies.
Lovely, thank you. Support, 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 as Baroness Barron famously said in the House of Lords. Thank you. And thank you particularly for your openness and honesty, Katie. It's not easy to come here for any of you and be so open and share information. I know it's a big ask, so thank you. We come into Morag next in Cheshire West and Chester, but just before we do, a reminder that the link is in the chat now to put some successful cases in. It doesn't ask for very much information, it's anonymous. Please do share some, and then we can come to a couple of those at the end. Morag.
Oh, thank you. Good afternoon, everybody. Thank you, Katie. I'll do mine about 5 minutes now. Okay, so those of you who, there's a lot of you in the Northwest that probably do know our picture. So we're quite a big geographical area. So as you can see there, we've got quite a number of schools, 9 independents. We're quite a small, well, we are a small team because, as many of you will know, we were legal only. So we went statutory in 2018. So I'll talk a little bit about that later on. So Cheshire West is a funny place. So we do have areas of deprivation, and we have industrial poor pockets. We've got Ellesmere Port and Winsford and the likes. But then we'll have areas of affluence like Hertford, which is leafy green, and there's like one estate where suddenly everything drops. So that's where some of our data has been really useful. And yes, so we've got nearly sort of half of our high schools, well, more than half are now academies, and likewise with the primaries, about a third of them are academies. So if I go to the next slide, please. So what I've done now is I've kind of given us a picture of where we're up to and where we're going next, and then I'll come at the end and sort of give you a few words about how we got there. So in terms of attendance data, yes, so we have an insight and intelligence team, and they're using Power BI, and so they have extended not just what they're statutorily collecting, but they've done some particular sort of nice little scatter graphs about where children with free school meals or pupil premium or with SEND are living, and we can do little dots around where they are geographically right down to their patch. So that's been really useful. We've got, although we are using the DFE daily return, the council has also had a previous commitment where we've got a system called Orchestra, which will join up all our education systems. So be able to draw up the children across those education processes we just talked about there, with the exclusions, admissions, SEND, and we can match them with our vulnerable pupils data. We did last spring term, and we repeated it in the summer term. We did, because like Katie was saying, these children who are severely absent, who are they? That was the question we wanted to know. We wanted to know what their characteristics were. So we did, and I think some of you have seen this presentation, but we did a severe absence snapshot. So we were asking our schools, and because we've got great relationships with our schools, because we've been statutory only, we've had to rely on good communication and keeping those sort of chains of communication up between them. So we asked them, who are these children? Have they got diagnosed SEND? Have they got undiagnosed SEND? Are they on free school meals? And the data is just fascinating, because we found out that of all those, that on that particular one day, because it was only a snapshot, we had 488 severely absent pupils, and which in Cheshire West that would be, you know, 2 good sized primary schools. It could be half a size of a high school. It could be 1 tutor group per high school across all the high schools in the council. And would it hit the headlines if those children were missing for half the week for that whole class or that whole 2 schools? And that's the and we said, and of those children, 22% of them were 10% or less. Obviously, understandably, half of them were free school meals. 27% of them had diagnosed SEND, but 19% had undiagnosed SEND. So that's when there's sometimes fractions between schools and parents, and when we can't get, sort of other interventions in place from other professionals. Just under 9% had educational healthcare plans, but 44% of them, which you'll all know, were absent with an undiagnosed anxiety or mental health problem. And the most important thing to talk to leaders about was that only 9% of them were looked after children or open to children's social care. And even less were open to early help. So we weren't targeting those people. We also had a snapshot at the children, who were not in full-time education. So they were children who had authorised absence because they might be off because of exclusions or because of part-time timetables agreed. They could be waiting elective home education. That was another 433 pupils. So then now we're suddenly talking about 1,000 pupils off school that day, and nobody's working with them, or not many of them. So that we'll come on to that. So that was what got the ear of the leaders. We were very concerned about those children who were on not accessing their full-time education. So we reviewed the part-time timetable and the alternative provision policies, and we've got a new form that's now gone online, and we've just started. Well, it's happening on Wednesday. We're having our first panel where we're going to challenge those timetables that we don't think should be going where they should be going. So the ones that are absolutely fine will be fine, but if we think they're too long or not in the best interest of the child, we'll have the right people around the table to put those challenge in. We've been quite late in doing an attendance strategy, primarily because we're a small team and we had lots of other bits and bobs to do, but we've now got the attention of the Safeguarding Children's Partnership, and that's been crucial. So they have now committed to help us develop and promote the attendance strategy. So if I have the next slide, please. And they've committed to do several things. So they, as it says there, they're going to create a dashboard with all those children that have poor relationship. They've called it a fractured relationship, but they are going to put it in their strategy planning, which is a really good thing. They're going to send it on to the Children's Trust to make sure that inclusion is consistent across our schools, and that they are properly sending their Senkos for training and making sure that we are working with the mental health teams to look around the ADHD, ASD and the trauma-informed approach. And they've committed also to make sure that schools are using part-time timetables appropriately. We have been working with health, so we've done lots of training with the integrated care boards and with Starting Well. That's our old school nursing product service. And we've got some mental health in schools teams. So we've all been briefed, and we've all, encouraged them that attendance is everybody's business. We will be launching, when we get the strategy done, a pledge or a charter. We've had some great examples from Liverpool and Sheffield. So when we get to that point, we will look at doing a Cheshire West version. So next slide, please. So in terms of working with schools, because we were statutory only anyway, we had set ourselves up to have a named person for each district. So we have 3 geographical districts in Cheshire West, and that is the way that our early help and our children's social care is set up. So every team in that locality, in that district, would know who their named education welfare officer was, as would the schools. Again, because we were so scantily staffed, we knew that we had to tell them not just about the new guidance that hadn't come out then, but just about attendance practice in the first place. So we did set up network meetings, which were to provide training and to share good practice. And obviously now that new guidance has come on, we've extended that to sharing good practice and removing barriers to attendance. And like you, Katie, we have different themed events. We've introduced sharing good practice sessions, and we are doing those face-to-face, and we've had loads of high schools said, come and do it in my high school, come and use our hall, which has been really nice. But our first one that we trialled, we did do it in a council building in the Winsford and Northwich area, and the schools really valued that, and they all brought a difficult case to sort of share. We've connected attendance staff from similar schools for peer-on-peer support, so they might not be even the same kind of school, but actually, you know, that particular school is doing this piece of work really well, and they could go and help that school over there. And also some of our attendance people in school were feeling very isolated, so it was just nice to have somebody on the phone to go and chat to instead of ringing us all the time, like you say, Katie. We have finally got some approval for some expansion of the team so that we can start to do the targeted support meetings. We've not been doing them currently, but we do give every school an annual register inspection, and we've always done those in this area, but now it's turned into quite a long and big piece of work. And we did have a colleague who'd joined us once from Surrey who told us she didn't think much of it really and thought it was more of an audit, but actually it's what our schools are used to, and there's lots of information. And we are using now the DFE daily return to prepare for this meeting, so when we get to the point of talking about the PA and the SA pupils. I think something else you said, Katie, about meeting with the academy CEOs. So our senior leaders have only just started that process of having meetings with them, and we're hoping that attendance will be a key part of that. So go next slide, please. So in terms of like joining with all of our doing a multi-agency approach, we are now we've been collaborating with SEND and the Educational Psychology Service and Early Help. So we haven't decided what they're going to be called, but there might be surgeries, there might be discussions, but we're going to have monthly meetings with our SEND team and the Early Help teams, so that workers from those teams will discuss tricky attendance cases. Our SEND team was having quite a few problems because their communication wasn't great. And so actually we've been to talk to a parent carers forum, and this is the way we think we'll go forward, to, you know, getting together to discuss these tricky cases so that the SEND officers can go and give the right information to the school and the early help and vice versa, and we can share the load. So I'm just about to do the attendance training for our own SEND team, and then we're going to extend it to the SEND teams in schools, because we found from the parent carer forum that was a big area where they had funny notions like, can you prosecute somebody who's got special educational needs? Well, yes, you can, but is it the best thing? What can we do? How much do we amend the timetables? That, you know, there's a lot of fear around what actions you may or may not take when children have got SEND. We already had the emotional-based school non-attendance tool, which is run by our educational psychology service. So that is an established piece of work which is developed as we've gone through with the new guidance, and then they provide the training for that service. Our early help and prevention service does have commissioned mental health workers in the early help offer, but as ever, that's only open to children who are open on a plan with the local authority. We have team around the family. We have. Katie, your question. So what we decided to do, because we can't get people together, so we have something called an operational management team meeting, which is what we used to call in old money was an extended SMT. So it's not just the senior managers, but it's the next layer down. The team leaders come along. So it's everybody in our so at the moment, it will be in the education team. So we'll have SEND, educational psychologists, people that manage exclusions. So all the education teams will be there. Obviously, talking to our colleagues in early help and social care, we're going to enter the details on our children's services system, so we can put the part-time timetables directly into that social workers tray, and we'll be doing sort of virtual response from them. So that's how we're going to trial it on Wednesday. We've made cross-partner working at the heart of our attendance pathway and EWS guidance pack. Like yourself, Katie, we've got a big pack which we created at the beginning. We started doing our ways of working, a trauma-informed approach in Cheshire West probably a few years ago, and it was heavily invested in. So we've got the buy-in from the police and the schools and all the agencies, and so we've connected into the key leaders in that process to make sure that attendance is in those discussions, and that actually schools are able to do that kind of early work with the parents and the children in a trauma-informed way. And that's worked out really well because the data for them tells them that most of the kids that have been discussed at learning conversations and multi-supervision meetings have got poor attendance. So we're working hand in hand with them. The interest, so we already had appointed an officer to do the monitoring and improving the attendance of children with social workers. She's been brilliant at going around with the social workers and spreading the message that to put attendance in their plans. But then we worked together and created a children's education performer. So we created a working group. We had buy-in from all the social work leaders. And now it's been put into place, it's up and running. So every single social worker, every single family intervention worker now has this pro forma, which they sit together with the school to complete. It's not just, and we can share a copy of that. I think our DFE advisors had a copy anyway. We literally, it's not just about attendance, it's about who picks Johnny up at the end of the day, who are the people in their lives, who do they play with, and then it has everything about their SEN needs or about their behavioural needs. So it's a great piece of work that's had complete buy-in from the children's services. At the moment, neglect is being reviewed as part of our continuum of need review, and so we've jumped on that bandwagon as well. And we are making the case for educational neglect to go into our continuation of need. And again, we've had great examples from colleagues and other authorities. So thank you very much for that. When I talk about the public interest test being applied to the holiday FPM process, obviously we do that from a legal point anyway, but we're thinking about putting it in a really simple sentence for schools to know about when they're putting a request in for a holiday FPN, because sometimes they find themselves in a sticky situation thinking, is this an exceptional circumstance or is it not? And they phone us up and they don't know, well, they'll make a choice themselves, and then they're not really looking at the whole financial situation around the family or the public interest test. So we're going to do them a little guide. So actually they've, because obviously news goes like wildfire in a playground. So we didn't want schools to be in a sticky situation where they're letting some people off as they would see it and not other people. But actually we can say it wasn't in the public interest to do a prosecution there, but we're going to unauthorise the absence anyway, but not fine. So that's just something else we're going to trial. And next slide, please. Oh, yeah, so we're doing lots. So I will just add in all the notes that I made while you were talking, Katie. So in terms of our communication, we're using something called Government Direct now, that would be a direct sort of messaging to get communications into school. And like yourself, we're developing e-learns. So because we found that attendance turnover was really great in our schools. So once we can create those e-learns, then they can go on that Gov Direct. And rather than me having to go in to do induction training in the schools or a colleague having to go in, they'll be able to log in and get that sort of basic training going on. Talked about surgeries. We are going to, through the Association of Education Welfare Management, obviously we've looked at the frequent illnesses problems, and we've got the systems that they use in Birmingham and Norfolk. So again, we've done some work with our medical needs team, and that's something we're going to go and put into place. But I know Adam was keen to look at how we've come on this journey and what we adapted to sort of get to this point where we are. So obviously, when we started out in this statutory world, we delivered training on attendance guidance anyway to all children's services, schools, heads and executives, and then we extended it to starting well. We had already created our attendance pathway, our guidance, our templates. And so when the new guidance came in, we were just able to update it and amend it and make sure that we're satisfying what the guidance was telling us to do or advising us to what to do. So that was really easy to do. That was a quick win. As was our network meetings, which had already set up. So that was a quick win for setting up our good practice sharing sessions. And the register inspections, because we're now using the DFE daily return, we're really developing and paving the way for how we will do our targeted support meetings when we hope to get them up and running in January, when we have a little expansion in our staff. To put that pressure on senior leaders to make sure that suddenly now I find myself on the strategy action plans for early help and prevention and for SEND, and attendance is a key feature of all those plans. And it's because we've shouted loud, we've spread our message everywhere, and they were shocked by the severe absence data, and that, you know, our targeted resources were not hitting these children. So that led to them having to escalate it right up to deep, you know, to senior leaders, and then it was put into a senior leaders development day. And so we're just doing the exercise again. We asked for the data to be in last Friday, so we'll get together this week and look. I imagine it'll be higher. But yeah, so that was really why, and then that led us to do a review of the service. So we were able to use that data in the severe absence exercise, and thankfully it was a laborious task. You know, we had to go through every process and time it out, and what case and what was the output and everything, but we got there. So I think the key thing is, I won't talk about the staffing model, but they did create a new manager's job. So that meant that the team lead, we could put in a team leader who does the operational stuff, but actually it was a commitment from the council to put a manager in who can actually work on this, you know, actually take time to work on the strategy and to be able to sort of keep that pressure on at a higher level. As I've just said, we made sure that attendance was part of the trauma-informed approach, the R ways of working, and I've just alluded to those strategy action groups. We've been working with the DFE advisor who's been coming into us, and we've attended all the DFE learning sets and briefing sessions. Sharing practice and learning with other local authorities, that was been really useful. That helped us, you know, get to where we are at the moment and pick up other ideas. Working with the officer for the children, with the social worker. And then just to give you hope, so I tried from the very beginning to get the support of the Safeguarding Children's Partnership, and they weren't listening. And I think the big thing that changed, there was a changing point, was the severe absence. But my colleague who deals with school exclusions, we were invited to talk to a meeting that I do not know the title of it, but it had people from the hospital, the Countess of Chester, it had the police, it had all sorts of leaders. And they wanted to know about all these children that weren't going to school and why they got excluded and why they didn't have plans and why they didn't have social workers. And that was a really good opportunity for us to explain what happens in schools, what the expectations are, what we've got control over, what the joint effort. And that's, you know, really everything I said that the Children's Trust and this SCP are now going to do came out of that meeting. So I think that's the last slide. So I think my advice would just shout loud, get yourself known, keep going with the message. And actually, it's been really nice to see, or to actually get invited to the Early Help Strategy Action Group to have a key part on their group. And then from that, suddenly you get involved with the neglect review. And so it's just been a really good, positive journey, really, I think, to get that commitment from the council. And the schools have been, you know, the problems that we have from schools, we now feel we've got solvable solutions, like the e-learns, like the good sharing practice sessions. And I think that's kind of where we're up to at the moment. If you've got any questions, I've bumbled through that a little bit.
Thank you very much, and hugely inspiring, I hope, for many people. You undersold your role in it and the sort of tenacity that you needed to bring from a very pruned back service to build something like that through tenacity and, as you say, shouting, but also having the guts to keep shouting and keep pushing, because it's not easy to do that, is it? As many of you have found in your own local authorities. So thank you for everything you've done. And for your honesty and openness this afternoon. Questions for Morag in the chat or hands up, please. While we're waiting for one, just one from me. You're not going to get away. I gave Katie one, so I'm not going to let you off without one either, Morag. But it was a question really on your join up with social care, and that is that's a bit that lots of people are really struggling with, isn't it? And you've made some progress there, probably still some to do, but sort of tips, ideas, reflections on getting that awareness raising with social care.
So I think the particular person who's been appointed to that job is very good at it, and so she has been really given the social. I don't want to say given the social workers a hard time. That sounds really negative, but she really has promoted herself well with our children's social care teams, and the key was to involve the team leaders and get them on board. The attendance pro forma has been incredibly useful to them, you know, so that's what's helped them with their assessments. We also had a very difficult case in the summer, and it ended up with a bit of a horribleness, you know, we made an escalation, and we had a bit of complaint against the IR, and that was all about emotional neglect. And actually that fed into the passing on this we call it the children's one pro forma. And I think it's just because we're sort of doing these surgeries with early help, and then that work is doing them with social care. It's just the vocabulary that's opened and the dialogue between us, and they are as the early help staff. They're as stuck as we are with these attendance cases. So let's sit round and discuss them together. And one of the things I forgot to talk about, and it's something you said, Katie, about having the fast track panel. So we wouldn't be able to resource that, I don't think. So we do have, we meet with our legal people regularly to discuss complex cases, but we already have as our early help and sort of social care, we have a case management meeting, which education welfare used to sit on before we weren't caseworking anymore. But that is one of our proposals, that we will take, these extreme severely absent pupils cases, possibly even some of the PA cases, and one of our team leaders will sit back on that meeting. So that will be our kind of monthly dialogue then, to sort of get those cases. We have something called a 360. So these referrals come in and then it passes round and goes into our integrated access and referral team. And then it looks whether it's going to early help or whether it's going to go to children's social care. So that's the plan, is to get back into that meeting. It exists already.
Yeah, and at the risk of speaking for poor Katie, it's a little bit more manageable, I think, by the point at which you've upskilled the schools to the point where they can hold most of the cases. So Katie's team probably couldn't have held it when they were at the point you were, Morag, are now, sorry, but they've got to a point where schools are holding much more of the case, so that the few that do come through, or the smaller number that do come through, they can help and contribute to. So yeah, it's part of that progression and journey that we're talking about, isn't it?
And I think it is, beg, steal and borrow by all means. Yes. But I think that was key, because like you say, with our schools having to do everything themselves, some of them are brilliant at it, some of them still have a long way to go, but by empowering those people that are doing it well in those schools and encouraging them to go to another school is a good thing. And we've got I've got 3 brilliant officers who are fantastic at supporting those people in schools, and the family anti-veg workers as well. So yeah,
super. And I mean, both examples are a real testament to what you can just do with a very small team, as difficult as it is, if you have the right mindset of what can we do rather than what can't we do. And again, as came across in yours, Katie, originally, it's taking a step back and thinking, do we need to do everything that we used to do, or do we need to do it in the same things but in slightly different ways and things like that? At the risk of getting into even more trouble, is Natasha from Blackpool on? And if so, can I put Natasha on the spot? Just to say a little bit, I mentioned earlier about training for social workers in Blackpool, which was a big part of their approach at the beginning of the work. Could you just say a little bit, Natasha, about how you did it and what you found useful about that, linked to Morag's point on social care?
Yeah, definitely an awareness raising exercise, because it was really interesting that some of the questions being asked back when we were doing the training sessions were sort of exposing the absolute lack of understanding, which then we've got to take some responsibility for. And say, yeah, because we get mixed up in education language, and we get mixed up in talking in percentages that we fully understand. So I tried to keep them to reasonably small numbers, and I did a manager awareness raising, and then I've done some new social workers, or ones who've opted to go on a course called The Bridge, which has been set up by the virtual lead here for children with a social worker. Both have worked well, and both have definitely started the ripple effect. But my next aim is to get now to the managers and try and talk to the managers, not the ones who were at the original meeting, but the ones that lay a layer below, and actually look at how it impacts in their teams and what they can do, how they can thread it into their work, and start relationship building more than anything, I think.
Yeah, that's lovely.
Definitely on a journey. We're not there, but we're on a journey.
No, but it's a good thing for people sitting there thinking about it. And it's another example of this point, isn't it? Of we really struggle sometimes to get the engagement with services, and there's been a historic barrier there, but let's not look at the barrier, let's not look at what we can't do and think about what actually could we do to try and start and break that down, and recognise it's going to take time. And thank you. That leads us very nicely on to our final speaker, and we can welcome Penny from Knowsley. And the slightly tenuous segue there, Penny, is that you'll talk a little bit about the work you're doing on education neglect and the overlap with social care in your presentation. But over to you, and welcome.
Absolutely. Afternoon, everyone. I'm Penny France. I'm the interim head of service for education in Knowsley. Prior to this, my substantive post was or is education improvement officer, and part of that job was at one point to line manage the attendance team. So that placed me in a really strong position, and hence me still having a love for all things attendance. So we're a small local authority, as you can see, and we have managed to grow our statutory team slightly with some temporary funding, and that originated from some COVID recovery funds originally from both education and health. And I'll touch on our structure as we move through. Next slide, please. We are implementing the guidance as of now, but actually we've been in a really fortunate position. We had a DFE mentor like Morag did, and some of the work that we were already doing in the council actually informed what originally was the white paper, and now, as we know, is working together to improve school attendance. So we are in a fortunate position because a lot of what we were doing is a requirement now in that statutory guidance. And like some of our neighbours here, we're very distinct in our makeup, being a very deprived area. Not many secondary schools, which has its bonuses and has its drawbacks, but we have got historical low attendance and high PA, and I'll be honest, and we still have, but our data is showing that we're making small but impactful improvements. Next slide, please. I spoke to about just giving you some background. So we actually launched our new strategy back in September 2021. At the same time, we were provided with a DFE attendance mentor. That's really worked fantastically well. And we have a graduated response to attendance, which makes it very clear who the roles and responsibilities of different professionals within that structure. And we have a toolkit also to support schools. And as I mentioned before, we extended our team. Next slide. And our broad consultation for our strategy at that point really hit on what everybody's been saying, that it is really important for us to get a wide buy-in and support for any strategy and any change. So if you're at a point now where you're just considering the change, that would be my key bit of advice for you, to get everybody on board right from the start. So consultation was with schools, it was with pupils, it was with parents, it was with children's social care at all levels, so social workers in schools that we were having, mental health support teams, early help, family first, youth offending service, crime and communities, anyone that we felt there was a link. It was really interesting. Oh, and of course the school attendance service, because they had lots of views as well. And it was really interesting that the same sort of broad themes came out, and it was that we know that there are all these agencies, but we're not maybe working together in a joined up approach. Schools need to do more. It was like a hot potato. Let's get rid of that child. And if we pass it over, we don't have to think about them anymore. No. We all have a real distinct role to play. So a real emphasis on what we call in our strategy level 1 work, that initial identification. So the data was important here. What are you doing? What can you offer? What else is out there that you might want to tap into at this stage? We mapped all of that out in the toolkit, and we did quite a lot of work that linked in research-based thinking around what is effective for preventative early intervention work. We found we still operate a traded service. We think that is massively important. Our approach in Knowsley is about prevention. We're not massive advocates of any sort of court type work. I couldn't think what the word was then. Prosecution work, because we know it has limited impact, and we know that there are pitfalls and not all cases can get there. So it was really about prevention, and we've kept our traded level because we need to. We can self-fund that, which is really good, and we need to target these children that are at risk of moving into PA and SA now. And we needed everybody to be clear of when, at what point their support is the most appropriate. If you'd like to move on. I've talked about that. We have right from the start, from level 2 support, when we can see that the school has done everything they can, we bring it around an AIMS meeting, an attendance improvement meeting, which is a little bit like a TAF, and we bring in all of the agencies at that point into a meeting to look at how we can best support that family, and we have a whole menu of different approaches at the traded level that might support them, or it might not be suitable for us as a traded service. We might encourage another service to take over. Now, the only reason we can do that is through that consultation, and then at the launch of the original strategy was there was a series of briefings and training to everybody so that everybody understood where they sat in that. We're probably a little bit ahead of MORAG, because at this point we also reviewed our education and neglect strategy, and we realised that because not all cases are suitable or in the public interest to be prosecuted, we needed to acknowledge what we do for those really difficult cases. So we reviewed our education neglect policy, and the main change that we made in there is that we didn't insist anymore for a case having to have been prosecuted previously in order for it to move through to education neglect. What we look at is risk and level of risk. And linked to that was the establishment of what's now called the Complex Low Attendance Avoidance Group, colloquially known as CLAG, which sounds like something nasty that you've got in your throat, but it works. And this is a group of people, not a panel. We were very keen to say we're not a panel, who receive referrals from schools in an electronic way so that we can do some data analysis of what we're getting in, where they are concerned about a child who has low attendance. And the purpose of the group is twofold. The first role is if a child already has other multi-agency involvement, then and the school perceives there to be delay or drag on that particular case, we put the challenge in. And the second element of our role is where a school where there is a child that doesn't have any other wider involvements, then we look to signpost and ensure that everything has been done, and where necessary we can triage and say we think you should make a MASH referral. Now, we have really broad attendance for the panel members. We've got education, we have SEND, we've got social workers in school team, we have early help, family first, children's social care, someone from MASH, YOS, SHIELD, school attendance service, health via the school nurse, and the attendance officer from the children looked after team. And it sounds like I've magically done that, and I haven't magically managed to do that, but that is where we are now, and that makes us really strong as a local authority, because everybody understands the strategy, because that links to it, and understands the purpose of what we're doing. Thank you. If we move on. This is, you probably can't see it really clearly, but this is our graduated response. Level 1, school action. Level 2, traded offer. If you get that somewhere else and not through our SLA, there's still an expectation that that's the work that goes on. Level 3, we begin to move into meetings under caution, because they may lead to prosecution, but ultimately, similarly, we are expecting hopefully a turnaround still in those families. And level 4 is either prosecution or referral into educational neglect. So by all means, you can look at that in more detail in your own time, and I'm more than happy to discuss with anyone on a personal level about that. Okay, so if we move on to what we have been doing now with regards to data. So we're super lucky. Attendance is a council initiative for improvement. So we have that buy-in at all levels, and that really helps the work that we're doing. The local authority know about our involvement. I've been fortunate enough to do input into a number of meetings, so it's very high profile, and that really helps us. And you know, there's lots of positive actions going on. We always had consultation meetings, always at level 3 and level 2. So they have just morphed into target support meetings now. We've always had data packs, and that's always been part of the offer that we've extended. What's really exciting now is previously for our secondaries, because 5 out of our 6 are academies, we've had to sort of rely on them providing us with some of their attendance information rather than us having access to it freely. But now we've got access, so we are being able now to look at patterns that perhaps hadn't previously been revealed to us as such, and we're able to begin to do some work on that. So that's really exciting, and you know, obviously that's fairly new, so the more we get in, the more we can look at it. We are trying to really focus in what we are going to tackle, and due to the numbers of persistent absence, we have our conversations at the moment at this early stage are targeted around serious absence and vulnerable groups who are PA, and we have parts of our pack that identify and highlight that information so that we're able to, you know, work on a broad pattern of information and also on some pupil level data as well. That vulnerable information is really important because it indicates to us some other aspects that might have an impact on attendance for the children, such as child protection issues, child in need, SEND, elements like that we know will have an impact. I think I think maybe Rochdale mentioned before that they were looking at other things that the data will do that we haven't had access to before. So we also are looking at sort of postcode information at the moment and regional information to see whether that highlights to us maybe some hotspots that maybe will link with youth offending service or the crime and community groups, and then we can take that. We can look at what we could perhaps put in place if we see a broad pattern coming out there. And obviously that we have the CLAG group as well. Thank you very much. If you move on. So working with schools in terms of communication and advice, all our offices are geographically placed, which really helps us, probably will help us when we look into family hub work as well, which is really exciting. So there is a correlation between the geographical placement of a statutory officer and their traded officer, and we do that on purpose so that there is that link. And also because our strategy says, okay, we'll identify a lead child, but we're actually supporting the whole family because it's unlikely that the problem is totally going to be individual child based. We are about tomorrow to hold our first attendance network meeting, and we feel like we're going to see what a generic structure of looking at reporting key national messages, and that's really useful because we get those messages, but also people in the team sit on different boards. Like I'm on the Association of Elective Home Education Professionals, so there's lots of interrelated information that we can feed in there. We are then going to look at a specific CPD opportunity. So tomorrow we're looking at penalty notices and fining in general, and then a period of the network meeting where we share good practice, and that is facilitated by our attendance staff who will keep those sessions going and provide input and feedback. And then we've been looking at what other local authorities are doing with regards to providing newsletters. I think we've been looking at Salford in particular, and we are aiming to produce something similar of our own nature, so that, you know, not everything there is in place, but you can see that we're moving forward on that. Next slide, please. So our targeted support meetings are well underway. They've been helped because we used to run consultation meetings in any case. So for our schools that buy into our traded offer and have a service level agreement, they are having at the moment they will be having half-termly consultation meetings, and those schools that don't buy in or are independent schools will be receiving what is the minimum offer, which is the termly meeting. And based on our consultation meetings and the targeted support meetings that we ran in before the summer holidays, they're taking about 2.5 hours for a secondary and about an hour for a primary at the moment. Before those meetings, the schools are sent the data packs, which the statutory officers produce as part of their workflow. And they are requested, obviously, to have a little look at that data, the sort of 6 pages that we have of like general data that looks at patterns. I know we've mentioned in the meeting today about Monday and Friday absences and those sort of aspects that they might see across their individual school. And then the last section of our data packs is all individual pupil level data that's influenced also about vulnerable information, and also breaks down persistent absence groups as well. Thank you. If you move me on. So for us, the benefits that we are seeing and that we have seen is this full picture of school data, especially in the secondaries, as I mentioned before, and definitely more accountability that links in with our strategy, and us being able to signpost really effectively to what the best support we feel for that child with the intelligence and knowledge that we know that's going to help them, that fits within our graduated response. So I've put a couple of examples that I've touched on previously there. Okay, we move on. And then we were talking about sort of relationships. So as a small authority, it does provide some advantages in terms of people knowing each other across the council, about our co-location arrangements and aspects like that. And obviously our previous strategy that is now been slightly tweaked for the new guidance and will be launched in January, and that has allowed us to grow those relationships before. Early help assessments have always been a requirement of our strategy, and it's built in as a heavily advised requirement at level 1. Now, if it's not picked up at level 1 and it's unsuccessful, then it's picked up by our traded officers at level 2. I think what's really important to say to you all, if you're looking at educational neglect, is that we say that every time educational early help has been offered, it needs to be recorded, and every time it's been rejected by the parent, it needs to be recorded, and by whom, who's offered it and who's rejected it. Because when we come to look in CLAG for educational neglect, that's some of the information that we look at, that's another indicator of risk that might go alongside other risk factors that we know some of our families experience. So that's really, really important. And that has really improved. We also, in our toolkit and in CLAG, signpost schools to documents and resources that we know will assist them with supporting a family for them to agree to early help, such as, I won't be able to remember the title now, but we have a document that's about supporting and engaging families, and engagement approach that we have. And we also encourage schools to fulfill the graded profile toolkit, not the whole graded profile, but the toolkit, which is a 2-page document that also is an indication of risk. So they're really useful documents also for you to be aware of. We have a really good team of early help support workers. Again, that's in our level 1 offer, that we remind schools of these professionals that are out there that can assist with completion of early help, bringing together TAF meetings. We have CLAG, which is another way of doing that. A referral might come in and we might return back saying, this is additional work that we would suggest you need to do as a school first. And obviously we have a virtual school attendance officer as well, which is really useful, and a MASH attendance officer as well. And if we move on. So I've talked about early help a little bit. School attendants never are early help leads, mainly because at all levels of the graduated response, it is very time specific, the time that they spend with those families. So we feel it's not appropriate for us to be lead professionals in the long term. And that's made really clear, and our early help colleagues understand that. So we don't really offer that out. We do offer it at level 2, but the school would lead. So the school tends to always be the lead. And that's really clear with our schools now. They didn't like it at the beginning, but they understand that now, and they understand why that is. And we also have, with another colleague today, talked about pre-proceeding panel meetings. We have those. We're really conscious of the frustration for schools when there are cases that are not taken through because it's not in the public interest. And that's why we have a sort of fallback. What tends to happen for those cases is they are then referred into the CLAG group, and we look at what else we could maybe pursue, and we can also decide whether there is a case for educational neglect. So everything sits kind of quite nicely together. And I think most importantly for us is, as I said at the very start, our strategy is not about prosecution. We're not super fans in Knowsley of prosecution. We are massive fans of prevention and intervention. And we know as a council, we are much better if we work together. That's one of our key induction themes, that we are better together. And I think we are really making inroads to showing authorities what you can achieve when you actually have that really good joined up working. I think that might be missing that last slide, but I'm not, yes, so I'm not 100% sure. So
thank you very much, Penny, and thank you again for openness and for sharing the all the wonderful progress you're making in Knowsley, but also the bits where you still think you've got further to go and the bits that you're still building and adding on. And I think that's been the theme. I mean, what a joyous afternoon it's been, and I hope everybody has taken something and taken some inspiration from what can be achieved with very, very tight budgets and very difficult situations in terms of need. I think, I mean, for me, two wonderful things across everything that everyone said. First of all, who would have believed not that long ago that we would be sitting here having a conversation where 3 local authorities say that this is a council-wide priority, that everybody wants to be part of our work, that everybody's willing to listen and talk to us in a way that we just didn't see before. And that is one of the tiny silver linings to the very difficult cloud of the attendance situation coming out of the pandemic, and to this idea of working together, and that's lovely to see. And the other is just how much cross-pollination there is of ideas, people taking little bits from other people, or they'd seen something they were interested in, whether it's the Morag saying that she was looking at the pledge-based approach that Sheffield and Liverpool have looked at, and others saying that they'd seen and adapted and built on other people's ideas. And then really the other things that stood out for me were this crucial point that frightens a lot of people, which is that everything in the guidance isn't for the very small attendance team and service to do. It is a school responsibility, it's a trust responsibility, it's a partnership responsibility, and it is a council-wide responsibility. And in all three examples, seeing the importance of leadership buy-in, of elected members buy-in, but also of other bits of services across education, across the youth offending services and so on. That was great. And alongside that, the use of the data. So we can get bogged down, and I'm going to say something completely contradictory in a moment about individual cases, but we can get bogged down in data sometimes. But look how much that easier to access and more frequent data has opened up conversations to target the resource that you have got, to raise the agenda of the issue, to focus collective brains and collective teams on the problem in those three examples. So please, if you aren't currently making use of those things, make use of it. If you are, think again about what you've heard this afternoon. Is there another way we could look at it? Is there another question we could ask of that data to try and drill down? Any questions for Penny and for Knowsley? Hands up or in the chat. I've got two, Penny, so I had one for each of the other people. Sorry, I've got two for you. The first one is about working with the DfE advisor. How you found working with the DfE advisor. There's a bit of a rumour or a myth going around in some local authorities that it's an accountability tool, that it was for inspection, and it absolutely isn't. It's not the same as what happened in the national strategies. It's consultancy support to help you drive forward the bits you want to drive forward, but if you want to say how you found it.
Yeah. I mean, our experience, it was I had another colleague work with me at the time, Abby. We found it incredibly useful. First of all, because she absolutely championed the work that we were doing, and we weren't necessarily getting that from everywhere, if I'm honest. So it was really good and gave us leverage into making, really pushing forward some of these changes that maybe we were getting a little bit stuck with a little bit further up the chain. So we found it useful. There is an action plan you have to complete, but if I'm honest, I can see Phil's here. Phil's, I didn't say on the structure that we also have an amazing service manager for the team, and Phil's on. And what we've actually done is we've maintained the format of the action plan that Diane introduced with us, the DFE advisor, and we use that now for our action plan that we do annually that sits alongside all of the changes that we want to bring around within the attendance team. And we found that incredibly useful, and that's been very useful this year because we wanted to make sure and keep on track that we were actually implementing the new statutory requirements appropriately. And what happens is Phil and I meet, I think we meet about monthly, six weekly, and we just do a RAG rating of where we're up to, and it just keeps us on track. So that's been a really useful legacy. And then when we completed the full year with Diane, she then came and spoke at our we have an annual attendance conference that's open to senior leaders and also those operational leads for attendance, and she was able to come and again, champion the strategy, champion the work that we were doing. We don't always get that in Knowsley because our data doesn't look great. I'll be honest about that. We're down there at the bottom-ish. But we know it won't be a magical sort of instant improvement. It will be small steps. It will take time. So what we're doing is looking at that data that shows those tiny improvements, and we can see that improvement there. So for me, a very positive experience with the advisor.
Super, thanks, Penny. And then the second question really is about your traded service. Lots of traded services across this region in particular, historically, and lots of people who are making decisions and having conversations about whether they keep and adapt or whether they move away from that. It's very much allowed that you keep it and adapt it alongside the core offer. But how have you found that conversation and the move and adapting your traded approach?
Well, our buy-in has never been stronger. So I think that maybe says it all, that that there is an understanding across our schools of how the graduated response works. The traded offer is the foundation for what, if you want to call the core offer, which is the statutory offer, however you want to word it. We also find, which is worth other local authorities considering, that by having that traded offer, we have really clear evidence of everything that we have provided, be it through ourselves as a school attendance team, or whether it has been like drawing in the other agencies that can provide support, so that when cases are reviewed for prosecution, it gives us a really strong evidence base, which makes them more likely to, where they are in the public interest, to actually go through prosecution. And I was looking at some of our data for last year, and every single case that was able to go through to prosecution was successful in doing so. So I feel that, if you're really looking to build a really firm foundation, that's really important. And more important than that is we want to turn them around. So if the right children are being referred into traded work, we can maybe start reducing that group of, because this is how it is for us, that group of entrenched cases, and that's what our aim is. We turn around the ones that are beginning to get at risk, and that allows some of our other officers to begin to tackle and reduce that sort of entrenched case that's grown up from the pandemic mainly. So for us, it's working. It's not perfect. I maybe make it sound like it is. It isn't totally perfect, but we do feel incredibly positive about what we're achieving. We really do.
Super, thank you, Penny. And I think that's a key point, isn't it? None of the three speakers today, nor anybody else in the country, has now solved this problem or got the perfect service or have done absolutely everything they can. So please don't take that message from today that it's further away than ever, and I might never get there. Everybody's adapting and building, and people are, as I keep saying, are at different points of that journey. So thank you to all of the speakers for sharing where they are on that. Thank you to everybody else is doing and continuing to do this. So, as I said at the beginning, so much great work. I've been, where have I been recently? I was in Bolton last week, really brilliant work going on there, as well as in Rochdale, as I mentioned. And there's so much going on that people are putting real energy into in really challenging circumstances. I just want to finish on this point really about individual success stories, and not many have come forward, but there are some, and that is a good reminder of why we need to do it. So do challenge yourself to think about, in the middle of all the service transformation and change, what is the real difference that we've managed to make to children this year. And there are lots and lots of these cases out there, so do remind you of themselves when you log off for Christmas when it comes. But one here from the Wirral where attendance improved from 44% to 71%. Traditionally, under the old model, it would have gone straight for prosecution, but the conversation that happened meant that the early help support could be put in place, that the approach could be adapted, that somebody could work alongside school and other agencies and get that across the line in a really good way. I saw a very similar set of cases in Sefton when I was there this year, right over the other side of the River Mersey, and really impressive to see how the change in challenging those cases that were coming forward to prosecution had led to that, and where schools could work with agencies to make a difference. And the same in some of the target support meetings that I've had the pleasure to sit in on this term in particular, that conversation, just sitting down and actually looking and asking each other questions about cases that everybody thought they'd thought everything they possibly could about. That triggered some new ideas and new approaches to put into those plans and to get those across the line. So please do, when you finish this year, as well as thinking about how far we've come on the journey to implementation, remember all those really positive individual stories in a dark and difficult time for so many. So thank you very much. Merry Christmas when it comes, and thank you for everything you've done this year and will continue to do with your dedication. Thank you.
Thank you.
Thanks ever
Merry
so much,
Christmas,
Adam.
everybody.
Bye bye.